Hey everyone, and welcome to this explainer. I am absolutely thrilled you're tuning in because today we're diving into the ultimate psychological masterclass. What we're going to teach you today is exactly how mental health professionals measure and decode human personality. You might be wondering how a psychologist actually figures out what makes someone tick. Well, it turns out it's a whole lot more rigorous than a quick online personality quiz. Today we're cracking open the detective's toolkit to see exactly how these complex assessments really work. So, here's our agenda for today. First, defining assessment. 2, self-report, the direct approach. 3, projective, the ambiguous approach. 4, comparing assessment tools. And finally, number 5, the modern multi-method approach.
Okay, section 1, defining assessment.
Right off the bat, we need to clear up a super common misconception. Psychological assessment is not just handing someone a test. It's actually a complex, iterative decision-making process. Think of the psychologist like a detective. They don't just administer a quick quiz and call it a day. No, they systematically collect data, revise their hypotheses, and dig deeper and deeper to form a unified, coherent description of the individual.
Because let's be real, you can't truly understand a person just by looking at their current mood. You have to trace back their history, observe their current symptoms, and really analyze their environment to piece the whole puzzle together. By moving step by step through these areas, professionals blend multiple data sources into one cohesive picture of exactly how the past and present are actively shaping that person.
Moving right along to section 2, self-report, the direct approach. Let's look at objective personality tests. You can kind of think of these as the multiple choice exams of psychology. These highly structured measures rely on a pretty massive theoretical assumption, the idea that individuals can actually describe themselves accurately. You've got the famous MMPI, which was developed using empirical criterion keying. All that means is they built the test based on data of how diagnosed groups actually answered, rather than just taking a guess. Then there's the NEO-PI3, assessing normal personality using the 5-factor model. We also have the MCMI-4 for personality disorders, and the PAI, which maps directly to common DSM diagnoses, meaning it perfectly aligns with the official manual of mental disorders used worldwide. But let's take a step back and think about this critically for a second. If you think about how you might answer true or false questions about your own behavior, especially if you're, say, trying to land a specific job, or maybe avoiding a diagnosis by a court-ordered therapist, we hit a major limitation: self-presentation bias. People can, consciously or even unconsciously, try faking good to look way healthier than they really are, or faking bad to appear more distressed. So, how in the world do we fix this? Well, the brilliant designers of these tests built validity scales right into the exams to catch when a client is faking or just responding inconsistently. Plus, because these tests are entirely structured, they rely on automated or computerized scoring. This is a total game changer because it completely eliminates human examiner error, keeping the results strictly 100% objective. Which brings us to section 3. Projective, the ambiguous approach. This quote right here perfectly captures the vibe of our next tool. Projective measures basically act like a back door. They are designed specifically to bypass a client's conscious filters. They totally step away from that rigid true or false format and dive headfirst into the realm of the entirely unstructured. This whole approach is deeply rooted in the 1930s psychoanalytic theories of Freud and Jung. The core concept here is known as the projective hypothesis. It essentially suggests that if I show you something completely ambiguous and neutral and ask you what it is, your brain has to scramble to make sense of it. And in doing so, you inevitably project your own hidden internal structure, your unconscious feelings, and your unrecognized needs right onto that neutral stimulus. Let's check out the major players in this space. The most famous, of course, is the Rorschach inkblot test. Standardized systems analyze not just what you see, but how you see it. Like, are you focusing on color or form instead of just the whole shape? Then there's the TAT, where you tell a story about an ambiguous picture to reveal hidden internal drives, things like your need for achievement or connection. We also have projective drawings, like asking someone to draw a house, a tree, and a person to look for symbolic conflicts. And finally, sentence completion tests, where a client just finishes a prompt like, "My mother always." Now, while these can provide incredibly rich pictures of a person, this method does have some pretty serious flaws. Because the stimuli are so ambiguous, scoring them relies super heavily on the clinician. Naturally, this leads to generally poor reliability. But even more critically, clinicians themselves are prone to illusory correlations.
That is the very human tendency to see a pattern in the client's answers that simply isn't there. It's kind of like seeing shapes in the clouds, driven almost entirely by the clinician's own biases.
All right, Section 4, Comparing Assessment Tools. This illustrates the ultimate trade-off in the real world of psychology. On one hand, self-report uses highly structured, forced-choice formats, assuming mental states can just be reported. It gives us incredible psychometric strength, standard norms, and solid reliability. On the other hand, projective tools use open-ended responses, assuming mental states are hidden. While they absolutely struggle with diagnostic accuracy and standardization, they offer a really unique idiographic depth. Basically, they provide a rich, highly individualized picture of a person that a simple checklist just can't capture. Because of these huge differences in reliability, we see some real-world friction. Neutrally speaking, the source material notes that many forensic psychologists actually consider projective tests entirely unacceptable for court-related predictions, like assessing a person's risk for violence. The whole debate centers on the fact that projectives generally lack the established scientific validity required for the incredibly high-stakes environment of forensic court settings, whereas self-report tests are backed by extensive, rigorous validity data. And that brings us to Section 5, the modern multi-method approach. To truly understand someone, you literally can't rely on just one piece of the puzzle. Today's absolute gold standard requires integrating data from multiple methods. That means combining clinical interviews, self-reports, and behavioral observations all together. But wait, it goes beyond just the client. It also requires multiple informants. A psychologist will gather data from the individual, sure, but also their family, and maybe their teachers or partners, to form a truly comprehensive and accurate view. A huge concept driving this modern approach is called incremental validity. Clinicians have to constantly ask themselves, does adding this specific test actually improve our clinical outcome? It's not just about hoarding more data for the sake of it. It's about asking if the data from a massive, hours-long test actually leads to a better treatment result than if we hadn't used the test at all.
Interestingly enough, and honestly, this might surprise you, the research shows there is virtually no scientific evidence that long, time-consuming tests improve treatment outcomes more than simple, brief symptom checklists. This has sparked a kind of minor revolution in the field. Practitioners are rapidly moving away from these long, broadband tests, and instead shifting toward brief, problem-focused checklists that can be given weekly to continuously monitor a client's specific treatment progress.
Now, as we look at the modern landscape of assessment, we also have to confront a massive cultural question. If all these standardized tools are scored by comparing a client to a normative group, who exactly decides what is normal?
The hard reality is that many historical personality tests were normed on very specific, narrow demographics, often white middle-class groups from decades past. Because of this, modern practitioners are strictly taught to assume that cultural bias exists in both the test content and the cutoff scores until data explicitly proves otherwise. It's a completely crucial teaching point in the field today. Professionals absolutely have to critically evaluate the tools they use against the actual background of the living, breathing person sitting right in front of them.
Ultimately, the psychologist's duty goes far beyond just scoring a test and locking away the materials in a filing cabinet. Modern guidelines heavily emphasize that providing detailed assessment feedback directly to the clients is a core ethical requirement of the job. By using scientific thinking to explain the results clearly in plain, everyday language, clinicians help clients understand their own problems. This fundamentally empowers and motivates them for the treatment journey ahead. So as we wrap up this explainer, we've seen the highly structured math of self-reports and the much more ambiguous art of projectives. We've learned the gold standard is actually combining them all. But I want to leave you with this final thought to ponder. Knowing the distinct strengths, the unavoidable human biases, and the inherent flaws of these clinical tools, how well can any single test really capture the sheer complexity of who you are? Thanks so much for learning with me today, and keep asking the big questions.